This is a banner that's announcing that this medical mission was sponsored by 7 Rotary clubs from District 6560 in Indiana. And we're very grateful for them for providing the funds to make this medical mission possible. Here's the start in Sanu, setting up a triage site. Things are being unpacked for the pharmacy. People are gathering what they need most, and sheets are being put up to cordon off an area for privacy for gynecological issues and other exams of acquiring privacy. And in about 10 minutes we'll be ready to roll. Here's Linda sorting out odds and ends for doing the blood work, hemoglobin, blood sugar. Got the blood pressure will also be done at this station. Every patient that goes to the hospital will need to have this basic blood work done. And it helps the triage doctors here at the site to do a better job on their triage by knowing whether there's any hypertension or problems with diabetes or anemia. And here we've taken over a room in the clinic where patients who are going to be referred to a hospital that we will take in are going to be be interviewed for their conditions in their home and what their financial situation is like, because we like every patient to pay what they can afford. Pase adelante. They've already got the video projected on the wall that explains to the people what the experience will be like when they go to the hospital. It's in both the Spanish and the local language, Kikchi. Here's Dr. O'Neill getting room set up for the via cryotherapy, as it's known. Prueba rápido para, as it's the replacement for the pap smear laboratory process. And another room here. So they'll share rooms side by side, so Dr. O'Neill can supervise everything that's going on relative to the gynecology work that will be done today here in Sanu. Setup is always a little bit hectic. The first few minutes of every setup, because every site is different, and we're working in facilities that have no bearing to really what we're trying to do. This is the birthing area that they hope to have operating in the future here in Sanu, and we're taking it over for the day. This is people looking at an educational video while they're waiting to be seen by doctors. During the triage process, we have videos being shown. In this case, we're very lucky to be able to have our DVD player connected to a television. Otherwise, they'll look at it on a DVD player, or if there's electricity, but no television. We'll project it onto a wall with our own projector. This is part of the educational information put together by Rotarians from California and the Guatemalan company here in Guatemala. Here we are doing the preliminary interview for what's called Prueba rápido. It's a rapid test. We really call it via cryotherapy, to do a test for precancerous lesions of the cervix. This is a replacement for the pap smear process, which doesn't work very well in rural areas where You're very seldom able to get a woman to return, let alone have an accurate laboratory test. The doctor that's in charge here of this whole process for this medical mission is a gynecologist. Her name is Dr. Mary Margaret O'Neill from San Jose, California. The translation goes from English to Spanish and then Spanish to Kikchi. And the nurse from the clinic where we're working, the Ministry of Health clinic, is doing the translation from Spanish to Kikchi. The first language of this whole area is Kikchi. Very few women, particularly women, know any Spanish to communicate any medical information. After this basic information is obtained, a physical exam will be given. Acetic acid will highlight any lesions that exist in the cervix, and if they do exist, these precancerous lesions, they will be treated with cryotherapy, which is freezing the abnormal cells. Standard process in dermatology for precancerous conditions of the scalp and the skin. Same basic idea. So far today we've evaluated over 70 women, and 3 of them have had cryotherapy or treatment for lesions, which is about the right percentage. 4 to 5% of the women seen will have a need for the cryotherapy. And this has been proven to be very, very good in reducing the incidence of cervical cancer, which is very high in Guatemala. This is one of the stations that our local area manager will be at to do the basic data collection for women that are going to have their the via done for checking for precancerous conditions of the cervix. Here we are doing the blood tests. Got Dr. Buddy Coleman filling in while I'm taking the video. He's doing hemoglobin and the glucose. And we have a Guatemalan nurse from the health center here, Herman, who is doing the blood pressure. All of this information is valuable to diagnose patients that may have problems that are not obvious in the normal physical examination that are given, and the hospital is also looking for this information. What's really interesting is to do the